I'm Will Satterfield. I'm the Bureau of Workers' Comp's Office of Safety and Hygiene rep for the Safety Council. Everybody should have an emergency action plan. You know, what are you going to do? Fire, severe weather, bomb threat. You need to have written procedures, spell out the responsibilities of who's going to do what. You have to identify evacuation and escape routes, set up a meeting place so that you can count heads, make sure everybody got out, and then any rescue and medical duties. The biggest thing is be prepared, and I can tell you this, all of you do have to have an emergency action plan. If you fall under OSHA or the Public Employers Risk Reduction Program, got to have it. For OSHA, if you have fewer than 10 employees, your plan, you can just tell them. It can be verbal. More than 10, you have to document it. It has to be a written plan. And if you have had one for a long time, practice it. Have a fire drill, simulate something. I've had employers that had fantastic plans on paper, but then somebody pulls the fire alarm, and it takes people 15 minutes to evacuate the building. People are going back to their lockers and getting their smokes and their cell phone, or going out to the car to have a cigarette before they report to the meeting area. And those are things you can't have happen, so practice it. And if you need resources to develop, we have written safety program templates on our website. It's pretty much an outline. All you have to do is make it fit what you do. We also have a good document on disaster and pandemic preparedness. OSHA, of course, has a lot of resources on their website, and the FEMA, Federal Emergency Management Group, has resources as well. That is it for the update. And our speaker today is Dr. Daniel Cobb from Alex Bell Dental. He's going to talk about dental health and how it can impact other aspects of our wellness, like sleep apnea, dementia, periodontal disease. So, Dr. Cobb?
Julia asked me to speak a little about how can we help you save insurance money and have healthier employees and live longer, and what can dentistry do for that. So that's what we're going to attempt to tackle today, and it's going to be in two different sections. One is about periodontal disease and how does periodontal disease affect our health, and then we're going to talk about sleep apnea also. So there are big connections between dental health and medical health. There are huge connections with Alzheimer's, with cardiovascular disease, with diabetes, with preterm births. Let's look at that as to what's going on with something like this. And as you can see here, that we can see that whenever we have linkage with gum disease, which is an infection, and if we're talking about this part of our body right here, it's connected to the rest of the body. If we have infection going on in here, this infection goes to the rest of the body, and that causes inflammation, it causes infections to the rest of the body, and then we get our major chronic diseases like diabetes and like cardiovascular diseases and everything like this. And so we can see that there's about 80% of the population that over 35 that have periodontal disease, and 95% of the people who have diabetes type 2, for example, have periodontal disease. And what's going on with this is that the bacteria causes inflammation in the body, and this inflammation starts causing all sorts of reactions with the rest of the body to create infection, inflammation, and then we get our issues as to what's going on with heart attacks and with arrhythmias and things such as this. And so because there's so much infection going on in the mouth, that affects the rest of our health. Some of the warning signs for gum disease are, do you have red or swollen gum tissue? Do you have gum tissue that bleeds when you eat or when you brush your teeth? Do you have signs of pus or infection in your mouth? Do your gums seem a little bit flappy, like they're moving around a little bit? They aren't nice and tight. Do you have bad breath? Do your teeth feel loose? Because what happens in gum disease, as that infection rages on and we don't get it taken care of, we lose bone, and that bone is what attaches to the teeth that holds the teeth in place. And so we can see as this degenerates that we can have these issues going on. Speaking specifically with cardiovascular disease, we have, the connections are that if you have inflammation going on in the body and you have this bacteria floating into the bloodstream, this bacteria will lodge into the sides of the walls of the arteries, and then that creates an inflammation there, and then you have the body that says, okay, we want to take care of that, and when it tries to do that, then it creates more inflammation, and then you have this plaque, and this plaque grows and grows, and pretty soon you have an occlusion of the artery, like in the coronary artery, and then voila, you get a heart attack. And so in order to reduce these risks of heart attacks, having a healthy mouth and the bacteria that is causative for this kind of stuff is necessary to eliminate, and that's why keeping our teeth clean, keeping our gum tissue clean, keeping healthy in the mouth is important. So that's with cardiovascular disease. And we can see that cardiovascular disease is the #1 cause of death in the United States now. It was United Concordia that did a study, and they found that if you have cardiovascular disease and you treat the periodontal issues that can be underlying this, you can save yourself about $1,100 a year. If you are a stroke victim and you have your periodontal health taken care of, you can reduce your insurance costs by $5,100 a year. So that's pretty significant for looking and saying, okay, how can I help my employees be better and lower my insurance costs? One of the cost-effective ways is, besides exercise, besides getting good sleep, besides good nutrition, is making sure that you don't have gum disease. If you do have gum disease, get it treated, because that's a whole lot less costly than it is to have a heart attack or to have a stroke. Diabetes is another issue. With diabetes, we have it goes both ways, that if you're a type 2 diabetic, for example, that can increase your risk of not being able to control the bacteria in the mouth. And we have about 700 different kinds of bacteria, but there's about 11 or 12 that are major disease producers, and I'll show a little bit later how we can identify those. So it's getting those disease-producing bacteria that's in the mouth, getting them under control, because we all have bacteria in our mouth and it's needed there, but we want healthy bacteria in our mouth and not disease-producing bacteria. So the whole emphasis on caring for our periodontal health is to reduce those disease-producing bacteria. And you can see that once we can control the periodontal bacteria that are causing disease, we can actually reduce the amount of risk for type 2 diabetes. And so if you have an A1C level, which is what determines what our blood sugar is over a long period of time, we want to reduce that and get that into a healthy range. And if we have good dental health care, we can reduce that and make it easier to control the diabetes. And that's where dentistry plays a part in helping with diabetes control. Another aspect is Alzheimer's. How many of you have friends, relatives, or people that you know who have Alzheimer's? You know, it robs you of your brain and you aren't the same person. There are many different reasons why we get Alzheimer's disease. There are at least 6 identified ways of getting Alzheimer's, getting the plaque in the brain. One of those is infections, and they are now finding that dental bacteria are getting into the brain and are causing these plaques in there that cause the Alzheimer's. And there's a whole protocol that we can use to help reduce that. And it's now been found out that we can actually reverse Alzheimer's. Obviously, the earlier you catch it, get it diagnosed, and get the lifestyle changes needed, the better the outcome is. But Alzheimer's disease does not have to be terminal. If you get it early enough, you can reverse it. Dental aspects play a significant part in that because of the connection between dental bacteria, the spirochetes, that are causative for this. There are many different causes that we have to look at, but dental is one of those reasons. Another aspect to look at is our liver. A major thing going on in the country that we don't realize is a disease called non-alcoholic fatty liver disease. And NAFLD is causing issues with the liver so that we cannot function properly. Where dental comes in is that the bacteria in the mouth can go down into the gut. It can create leaky gut. It can get into the bloodstream, go into the liver, and make the liver not function properly. And we oftentimes don't realize that the liver is not working until it's too late. And then we get the hepatitis, we get the liver cancers and everything like this. Well, that can be reduced, and again, it is a disease caused by our Western diet, caused by our lifestyles, and with this going on, we can change that and make that better. Getting rid of the bacteria that's getting into the gut that is causing this is another major issue, and that's where having healthy gum tissue comes back to that aspect of it. We're all one person, and so we have to understand that, hey, what might be affecting our gut, what might be affecting our liver or our brain or our heart, can start in the mouth. Another area is preterm births and stillbirths. And there's a dental bacteria that is implicated in being one of the causative factors for this. And when we look at that and we say, okay, how can we help people who are pregnant go to full term, looking at the dental health and the dental care is very, very important in doing that. And so that's another aspect that we have to look at in the gum area. What is the connectivity with all of this? And that is the biofilm. The biofilm is where the bacteria hides out in the mouth. And we have, 700 different species of bacteria found in the mouth, but there are about a dozen that are causative for illnesses in the body. And so what we want to do is we want to be able to get rid of the biofilm and get rid of it on a regular basis. And so one of those things is, going and getting your teeth cleaned on a regular basis. Right now we say do it twice a year. Where did that come from? Why twice a year? Why not once a month? Why not once a year? Why not once every 5 years? What was that? Really, the twice a year thing came out back a long, long time ago. And if you remember the toothpaste Pepsodent, I think they were saying on the TV advertisements, you know, brush your teeth with Pepsodent and go see your dentist twice a year kind of thing. And that's sort of been picked up. But it's really an individual thing. There are some people that have immaculate gum care and gum health and don't need to see a hygienist twice a year. Once a year might work out. Other people might need to see the dental hygienist once a month. It all depends upon your biome and your biofilm and how quickly you get plaque in your mouth and get calculus or tartar in your mouth and everything like that. So let's look and see what we can do for this. Back a few years ago, we weren't able to find out what bacteria was causing the periodontal disease. And if there are a dozen that are causing illness, you know, how can we find that out? Well, with the advances of DNA technology and bacteria, all we have to do is have the patient spit into a vial, and then we send that vial to a laboratory, and through DNA analysis, they can find out, okay, what kind of bacteria do we have? And when we know what kind of bacteria we have, then we can really target in how do we treat that? How do we take care of that issue? And here's an example of a person who, if we look at the very top on the top left, where I have the black circle, in the purple complex, they don't have anything showing up. But you go down to the next segment called the red complex, which are groupings of various kinds of bacteria, and you see that he's off the charts on that. And when you go to the orange complex, he's off the charts on that. We now also have the ability of finding out, is there any kind of yeast in the mouth? And so we can find out, is there a lot of yeast or not much yeast? We're looking for Candida because that's the major yeast component in the mouth that we're looking at. And we can find out, okay, if this person is off the charts in Candida, then we might have an immune issue going on, or we might have issues going on that the person's health is not healthy, that they are sick in other ways systemically. We also have the ability of looking at the bacteria that cause tooth decay. And so we know that there's one, Strep mutans is the major bacteria that causes tooth decay, but Strep sanguinarius is sort of the opposite, that it promotes it. And so we can look and see what's going on with the bacteria that cause that. We can see with this person that he was in pretty good shape with the bacteria that causes tooth decay, but he was off the charts with bacteria that cause periodontal disease. And we look and see that his yeast wasn't bad. And so we were looking at his viruses also. So we're looking at herpes virus, we're looking at cytomegalovirus, and we're looking at Epstein-Barr, because those are all common in the mouth. And so we see that in 3 of them, he's in pretty good shape. He does have some CMG issues, and so we know that there's a little bit of an issue there, but we can see now, okay, what kind of an antibiotic, for example, do we need to use to help get rid of this bacteria? Because traditionally, we would do scaling and root planing, where you'd go in and you would have the hygienist use some specialized instruments and get the tartar off your teeth and go down below the pockets and clean out the tartar, the calculus. And that's basically what we would do because we didn't know what else to do. Now that we know what kind of bacteria we're seeing, now we can target in various kinds of antibiotics. Some antibiotics work for some of these bacteria, other antibiotics don't. So now we know what we're facing, now we know what we're dealing with, then we can attack that. And the nice thing is, we can go in after we've done our therapy and we can say, okay, are we successful or are we not? And we can test again and we can find out, okay, what's going on and what's not going on. And so we can have a better outcome in taking care of these issues. Okay. One of the ways that we do this in order to get the biofilm off is that in our practice we're now using something called guided biofilm therapy. Typically when you go get your teeth cleaned, you'll have the hygienist go around with some hand instruments and maybe an ultrasonic and clean around, and then use a Prophy cup and clean everything at the end and get any bacteria that she might see, which it's hard to see, off and consider it a day. The problem is we're finding out that there's a lot of biofilm that's left because it's hard to see. We can't see it. We can see the big stuff, but you can't see the little stuff. So what we're doing is we now start out by disclosing and using some solution that stains the biofilm, the plaque, and then we can identify it because now we can visually see it. And then when we do that, then we can go in there, and we are using now something called airflow, which it's a combination of water and air and erythritol that's a slurry that goes on there, and it will blast the biofilm off the mouth, and we can take it off the teeth. We can go down into the pockets a few millimeters and clean that up. And so at the end of the procedure, we can see, do we have all the biofilm out of there or don't we? And if we don't, we can go back into those areas and clean it up, whereas before we really couldn't do that. And then if we need specialized instruments like an ultrasonic to go down and to vibrate some of that tartar off that's on the roots of the teeth, we can go ahead and do that at the same time and get this nice and clean. And we need to get rid of the biofilm. And then at home, doing things such as using a water pick or an electric toothbrush, which is immensely better than hand toothbrushing, because hand toothbrushing, especially with kids, you just hit the surface and that's it. Whereas if you have a mechanical one, you can do a whole lot better job. And using a water pick, oral irrigating kind of device really helps get in between your teeth. Flossing will work with some people. It doesn't work with other people. It depends upon what your gum health is and the level of your bone and everything like this. But there are things called picksters that get in between the teeth to clean it out and everything like that. So all of those are great things to use and do. And this is an example. So you see on the left side, that's undisclosed a picture of a mouth, and then you disclose it and you can see the massive amount of changes in color. The darker the purple, the longer the plaque has been on there. So that blue and dark purple, that has been there for many days. The light purple has been on there for hours, kind of thing. And then after cleaning, you can see how you get all of that off there. So the hygienist knows that she's got all the biofilm out of there. And here's a progression. You can see before disclosing on this particular patient, you can see the calculus up there. This is in pretty bad shape. And you can see how deep purple and blue that is and what's there and how it can get cleaned off. And then on the bottom slides, you can see this is the kind of instrument that we use that blows that slurry of erythritol and water and air on there to clean off the biofilm. And you can see how with it spraying like that, it can get in between the teeth nicely and can get everything out of there, whereas hand instrumentation might not be able to do that. So that's where we're coming with our number one area is we want to get gum tissue nice and healthy because it affects the rest of the body. And the second area where dentistry can help is with sleep apnea. And you'd say, well, what does sleep apnea have to do with dentistry? What it has to do with dentistry is that one of the ways of treating sleep apnea is by using a dental appliance. And also when you see the dentist, if you're seeing them twice a year, you might see your physician once a year or once every 5 years. You might see your dentist a little bit more often. We're seeing the effects of sleep apnea in the mouth. If you grind your teeth and you're wearing your teeth down, that's usually an effect of not being able to sleep properly at nighttime. And we have our built-in way of waking ourselves up when we go into an apneic episode, and our brain understands that it's not getting enough oxygen, and so it tells the muscles of mastication, the masseter and temporalis muscles, move around, guys, to open up the jaw so that we can breathe. And so we see a lot of people, and you know, especially after COVID, we've seen a lot of people that are bruxing their teeth, and then we have to asking, okay, what's your sleep like? And we're finding a lot of people not sleeping well. Not all of it is due to obstructive sleep apnea. In the sleep breathing disorders, there are many different kinds of issues, but we're looking specifically, because it's probably the most common, of obstructive sleep apnea. And so we have people with diabetes, with asthma, with acid reflux, with high blood pressure, with weight gain, with heart failure, and with auto accidents. And this is another thing in your workplace. You know, you have people coming in sleepy. You know, what's going on with that? And so the effects of obstructive sleep apnea are, we see people with type 2 diabetes, loud snoring, obesity, sexual dysfunction, cardiac arrhythmias, and there's a direct correlation between atrial fib and sleep apnea. And so if you start having atrial fib and you go to your cardiologist, one of the questions he's going to ask you is, okay, how are you sleeping? What's your sleep like? Might you have sleep apnea, kind of thing. Stroke victims are oftentimes have sleep apnea. Having to get up in the middle of the night and go into the bathroom 2 or 3 or 4 times, that would tell us that maybe there's a sleep breathing disorder going on. Excessive daytime sleepiness. What's going on with that? Why are you sleeping in the daytime? Is it because that you can't sleep well at nighttime? And oftentimes you might say, hey, I'm sleeping well at nighttime, I don't remember waking up or anything like this. But if you start looking at things, you are doing micro arousals to where you don't remember waking up, but your body wakes up enough to where it doesn't allow you to get the proper level of sleep, REM sleep, deep sleep, because sleeping is when we regenerate our body, and also when we regenerate our brain, when we store our memories. It's important to dream at nighttime. If you don't remember dreaming, you might have an issue. I had a patient just 2 months ago where we placed a dental appliance for sleep apnea, and 3 days later he called me up and he said, last night was the first time that I remember dreaming in my memory, and I'm 61 years of age. It's important to dream. That's part of the process of the body regenerating. And about 25% of the American population has some sort of sleep breathing disorder, and I think that's increasing. So here's some questions to ask yourself. This is a self-test here. Do you snore at nighttime? That's yes or no. And the snoring is it louder than talking? You know, can somebody hear you through a door? Are you tired in the daytime? Yes or no. Has anybody observed you stop breathing when you're sleeping, like on the couch watching TV and you stop breathing, or in bed? Are you being treated for high blood pressure, or do you have high blood pressure? What is your body mass index? And how you determine that is take your height in inches and your weight in pounds, and you go onto the internet and you ask for the BMI calculator, and you can find out. If your BMI is 35 or higher, that's a significant red flag that you could have a lower BMI and have sleep apnea also. But if you're getting it to that level, it's going to be pretty evident. What's your age? Are you over age 50? And what's your neck circumference? Is your neck greater than is 16 inches or greater? And what's your gender? Are you male? And if you're male, then that's a yes. And if you score 3 or more on this questionnaire, you're at a high risk. If you score 5 or more, I would suggest going and seeing your physician ASAP, because it is more than likely that you have obstructive sleep apnea going on. It's just off the charts. And you know, if a lot of people, when you hear people dying in the middle of the night and it was because of a heart attack or something like this, it's oftentimes because of sleep apnea, and they suffocated because they could not breathe. And so, you know, sleep apnea is not something to think lightly about. You know, do something about it. So there are ways of taking care of obstructive sleep apnea. A physician has to diagnose it, and so a physician will do a sleep test, and it can be either a PSG or a polysomnogram, where you go into a specialized place where they hook you up to all sorts of leads and do it, or you could have a home sleep test done at home, where you sleep in your own bed and you put a few things on you, and then you test yourself, and it gets uploaded to your phone and gets uploaded to the physician's office, and they can determine, okay, what's going on? Am I sleeping? Am I not sleeping? How much REM sleep do I have? What is my oxygen levels all night long? It tests for several different parameters to find out, might you have sleep apnea? And then if you do, the physician will say, okay, we have some options. And one of the options is a PAP device, a positive air pressure. And there are different kinds of PAP devices, CPAP, AutoPAP, BiPAP. It depends upon what the needs are. And what these do is they take room air and they push it through your nose, down your throat, and keep the opening open so that you can breathe back and forth, because the choke point are really in 2 different spots in our head here. One is up in the nasal area. If you can't breathe through your nose, that's an issue. And then one is behind your tongue, between your soft palate and your tongue, right in this area. And so that's the major area. If we can keep those areas open, then you can breathe at nighttime, then you can sleep at nighttime. But what happens when you're sleeping? Your tongue goes back because you're resting and you're relaxing and you're unconscious now. Your tongue will drop back because it doesn't have enough room in the front to go to, so it will drop back where it wants to relax, and your whole airway sort of collapses. And then that makes it so that you try to breathe, and your lungs are a vacuum machine, and your lungs are trying to suck in, but they take all this soft tissue and they create a vacuum, and they create a closure so that you cannot breathe, you cannot get air in there. And so what a CPAP does is it creates enough air to open this area up to keep the airway open so that you can breathe. This works very, very well, and it works for a lot of people. But as you can see, there's a lot of paraphernalia that can go on this, and a lot of people cannot tolerate that. They can't tolerate the hose, they can't tolerate the machine, they can't have something on their face, it's claustrophobic, they can't use it through their nose because their nose is blocked, and so it doesn't work for everybody. So what other options do we have? Well, there's a second option where if you fit the criteria, you can have a stimulator placed into your chest, and then a wire runs up to the nerve that makes your tongue go out. So when you stick your tongue out like this, there's a certain nerve that is stimulated that makes that happen. The brand is called Inspire. And what this does is it senses when your lungs are trying to bring in air, and when it senses that, then it stimulates your tongue to move forward. When your tongue moves forward, then it opens your whole airway so then you can breathe. And then when you're exhaling, that doesn't matter, and so then it relaxes, and so then it goes back and forth, and you're able to breathe at nighttime. And for certain classification of people, this works very well. It's expensive, it's invasive, you have to change the batteries out every so often, and things such as this, but it's an option. And the third option, which I'm acquainted with and which I do, are mandibular advancing devices. And so what we do is, if you're a candidate for something like this, we take impressions and then we bring your jaw forward, and by bringing your jaw forward, that opens up the airway back there, because connected to your mandible or your lower jaw joint are muscles that open up the airway in this area behind the tongue. And so when you bring your jaw forward, that opens that up and that allows you to breathe properly. And mandibular advancing devices are wonderful for people who have mild to moderate sleep apnea. When you get into severe sleep apnea, then it's sort of a case-by-case issue, but usually we try CPAP, but if you're CPAP intolerant, then going with a dental device might be the next best thing to do. And what we're finding is, at the end of the day, that people who use the PAP devices and people who use the dental appliances, their efficacy of sleeping is about the same, because the people that wear the dental device wear it all night long, and they can function with it, whereas people with CPAP tend to take it off after 3 or 4 or 5 hours, and so you aren't sleeping the whole night with your mask on or with your nasal pillows in for a lot of people. And so when you start looking at the big studies, they say for mild to moderate, dental devices work very, very well. And so those are the options that we have for something like this. And you know, when you're going on a vacation, do you want to haul all of your generators along with you and everything like this? You know, when you're sleeping with a group of people, do you want to haul out your PAP appliance and hook everything up? Or, you know, could you just slip in a dental appliance and have sleep as well and function as well and everything like this? So, depending upon, you know, what the issues are, dental appliances can work very well also. So overall, what we're seeing is that if you have people who are sleeping well at nighttime, they're going to be better employees in the daytime. They're going to have fewer accidents in the daytime. That's why truck drivers, I think, are now mandated that you have to have a sleep test every so often, and then when you get tested, and if you do have sleep apnea, you have to be retested. There's a whole thing going on with that, because a lot of truck drivers are falling asleep and causing accidents. Well, the same thing at work. You have employees that if they're excessively tired, you know, they're not going to work as well. They aren't going to work as fast. They aren't going to have as much going on. So that's what's important, is to help keep our whole body healthy. And this is where the dental arena can come in and help you and your employees take care of this. And so this is to your good health. Have a good day and stay healthy.